Good morning, bonjour, good morgen, buenos dias. This is to provide an update on the Zika virus outbreak in the Caribbean. At the moment, about 15 countries in the region have reported cases of Zika virus transmission in their country or territory. Globally, about 38 countries are in that category. The Zika virus, as you know, is a mosquito-borne disease spread by the Aedes aegypti mosquito that transmits also dengue fever, chikungunya, and yellow fever. The problem with Zika, initially thought to be a relatively mild disease, is that it appears to be causing an increase in two rare complications. The issue of microcephaly, or babies born with a small head, and a neurological problem called Guillain-Barré syndrome. It appears that Zika virus spreading in the population increases the level of these rare conditions. Both Guillain-Barré and microcephaly are very rare. They are not required to be reported in any Caribbean country or in the region, so there are little baseline data on it. CARPHA is now in the process of setting up the baseline data collection so we understand better where we're starting from, along with our work on strengthening the laboratory testing, providing public information, advising the governments, working with the US CDC and so on. Coming back to the spread of the virus, we have some factors not in our favor. We have the very susceptible population that has not met this virus before. We have widespread Aedes aegypti mosquitoes, and we have a lot of travel in and out of the region. There's another factor. In about 2 months, many of our countries, the rainy season will commence, and that will increase the possibilities for breeding of the mosquito. So this is the time to focus on the containment, the control of the yard, to reduce mosquitoes breeding by covering drums and tanks, cleaning the guttering, emptying the tires, and the measures that governments have been advising people. With respect to the Guillain-Barré syndrome, this is a rare condition. Approximately 1 per 100,000 people per year would develop it. It's not spread by mosquitoes. It often follows, when it does occur, it follows a pre-existing infection, a respiratory or a gastrointestinal infection. And what happens is that the body's immune system, in attempting to fight the virus, also cross-reacts or damages the nerves, and you get the inflammation of the lining of the nerves and the weakness and tingling and ascending paralysis that can come with Guillain-Barré. Males and older males are at slightly greater risk than females. A small percentage of people will develop paralysis and may need assisted breathing, mechanical breathing in hospital. At 1 per 100,000 per year, an OECS country may see 1 or 2 cases per year, for example. And if this, as a background, if Zika virus increases the rate, then maybe 5, 10 cases in a year if the virus spreads throughout the population, based on the data from the Brazilian experience. The situation is rapidly evolving, and every day and every week we become more aware of different aspects of the spread of this disease and how to control it. So it's important to stay informed. Again, to reiterate, the 2 most important prevention messages are to stop mosquitoes breeding by emptying water sites around the house, covering drums, etc. And the second is to stop mosquitoes biting, particularly if you're at risk, a woman who's pregnant, in early pregnancy, older person with chronic health problems, and more likely to experience complications from any viral disease. Those are key messages. Thank you.